Patient EE had his first procedure with Dr. Cole in 2016. The procedure consisted of 2,200 grafts. The patient had the desire to lower his frontal hairline. His hair loss was not very aggressive for someone his age. After evaluating his donor area, the number of follicular units available was average. However, the number of hairs per follicular unit was above average. His donor area consisted of many 3s and 4s hair groupings per graft. While most physicians marry their patient to one punch, cases such as patient EE do not respond well to the one-size-fits-all. Most physicians limit their procedure from 0.85 to 0.9 mm size punch. While it does hold true that a smaller punch results in less visible scarring to the donor area, it is not beneficial for a patient with a high number of hairs per follicular unit. The smaller punches will transect the grafts, thus reducing the viability of the extracted hairs. The patient had finer hairs on the sides of his donor, and a 0.85 mm punch was used for extraction. The more medium caliber, high-density grafts required a punch size ranging from 0.85 to 1.25 mm. In addition to having a transplant, the patient was involved in a study comparing regular PRP and sonicated PRP, or as Dr. Cole named it, CRP. The CRP was injected into the right side and the standard PRP in the left. The right side had more regrowth than the left side. Patient BCR had his first transplant in 1989. The procedure was a success and he was happy with the results for a while. Unfortunately, the patient continued to experience more hair loss. After each passing decade, the transplant stayed while his existing hair continued to fall out. The only treatment available to him during the time was Propecia. The risk of adverse side effects from Propecia prompted him to avoid the medication. Regenerative treatments were not available, and the patient let his hair go. The results of not having started any form of preventatives were a goofy, apparent appearance that a transplant had been performed. While the patient was happy to have some hair rather than none, it still bothered him having such a sparse amount. His goal was to create a bridge connecting his previous transplant to his donor area and filling in the frontal tuft. During his consultation, it was recommended to avoid building the hairline any lower. Dr. Cole recommended filling up the front. The lack of donor and the huge gaping hole in his crown prevented full restoration. Rather than looking silly with a low, broad frontal hairline and a Joe Biden bottomless pit behind it, the patient opted for a more conservative approach. Thus, Dr. Cole built a more natural, mature hairline, one that is common in men who experience isolated vertex loss. This procedure consisted of 3,000 grafts, CRP, A-cell, ATP, and a post-op kit. The patient has begun annual CRP treatments to avoid progressing to a Norwood 7. The biggest mistake most patients make is not starting regenerative medicine and/or medical therapy sooner. Had these treatments been more readily available 30 years ago, the patient would be in a far better position than now.
Forhair is run by Dr. Cole with 30 years of hair restoration experience. And we offer the most cutting-edge technology available. In fact, the Forhair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose Forhair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of Forhair's video uploads. For online consultation, click on the link on the screen or in the video description.